Hi, it's Dr. Ann Zink. Today is November 27th and providing a brief update with what's happening in COVID. I hope everyone had a small and restful Thanksgiving day and wanted to provide an update with where we're at with cases. So today we do have a total of 724 new cases. I will just highlight two important facts with the data. One, we have 62 cases that are being removed from the data dashboard as we're constantly doing verification, and those are duplicates, so they're being removed. I will also emphasize that we started to get lab results from a commercial lab not previously reporting. And so as a result, we are starting to see an uptake in the cases, particularly in the Matsu area. Going on to the next slide, you can see where our numbers look like compared to the rest of the US. In general, we all continue to be on this upward trajectory right now. It's important to remember those most recent days tend to be an underrepresentation because we're looking at dates and the timing of those labs. I will encourage people to take a look at our data dashboard, and you can look at onset date versus report date. That onset is when someone's symptoms began, when they were tested, and that is the most accurate kind of information to look at rather than the report date, given some of these reporting challenges. Overall, we've done nearly a million tests in the state of Alaska, and our average percent positivity is 6.42%. It's great to see that coming down, but there's clearly some variability across the state in that region. One area that we are seeing a real increase in the percent positivity is in the testing at the airports. We've seen a real increase, and it's now above 5%. You can see it was huddling just over 1% for a long time. Again, this is a real request for Alaskans to get tested prior to traveling. If you know your status prior to traveling, that's going to help minimize exposure on the plane and during travel. And so encourage everyone to get tested 1 to 3 days prior to travel. Moving on to the next slide, we are continuing to just build up our data teams and trying to get these cases in as quickly as possible and outreach, but there are some real limitations to that. Increasingly, we're having a challenge getting a hold of people for contact tracing, encourage people to answer their phone. And not everyone has a clear source, just as we see a lot of community spread happening across the state. We do know that there are kind of lower risk, more moderate, and higher risk activities. And so appreciate all those who were able to virtually gather or do things outside in that kind of lower to moderate category. If you did choose to attend an indoor gathering, particularly thinking like this Thanksgiving Day, realize that your exposure to potentially who has someone who has COVID may have taken place on that day. You don't want to get tested right away. You want to get tested a few days afterwards. So ideally, somewhere around day 5 after an exposure will help to see if you had potentially gotten exposed. So if you did attend an indoor Thanksgiving with people that are part of your immediate family bubble, considering getting tested somewhere between Tuesday and Thursday of this next week to make sure that you didn't accidentally pick up COVID-19 during that time. There's a lot that you can do to help break the transmission. So again, continuing to really keep your bubbles very small, that 6 feet, and that wearing the mask can make a gigantic difference right now. And then helping us to contact your contacts can also help to speed up the process so that people know if they've been potentially exposed. We do see a lot of cases in the YK region, and there is a recommendation out there right now to kind of just hunker down for the next month and appreciate all the leadership in the YKHC region along that. There have also been some additional local restrictions, and make sure that people take a look at their local restrictions and what those look at. There's also some information on our website about when you can return to work. Our team used to be able to contact everyone who'd been exposed and provide a letter saying that you are no longer infectious. We're really struggling keeping up with that. And so there is information on our website, including the CDC guidance and a letter that can be downloaded, including your test date, so that you can bring that back to an employer regarding your testing and timing. A couple other things I just wanted to mention, importance of wearing a mask properly. So again, it needs to cover your nose and your mouth, and it needs to be on at all times. So taking it off in the break room and eating with others is a place where we continue to see a lot of transmission happening. It needs to not be wet. And so if it gets wet, you need to have a clean one that you can be able to switch it out. Those exhalation valves that you see on them can cause spread of the disease as well because you're not preventing the spread from you to others. So make sure you're not wearing one that has an exhalation valve and make sure that it's easy to breathe through for you. It's also important that when you take it on and off, you take it off from the sides and that you wash your hands before and afterwards. Kind of think of it all being covered with COVID and you don't want to be touching it a bunch. And then store it in some place that has good air movement. You don't want to put it in like a plastic bag. You want to have good air movement. A paper bag can be a good option just so you don't get any bacterial growth and make sure they're washed regularly. So there's a bunch of other little information on there. Again, children under 2 shouldn't be wearing them. A face shield is not as good as a mask, but even things like a well-worn gaiter or again, a good well-made cloth face mask can make a big difference. Lots of information coming out about vaccine and vaccine trial. Appreciate everyone tuning into our Echo this week on vaccines, and we'll continue to keep updated. There are a lot of exciting and promising news on the forefront. The other thing I just wanted to mention is about treatments. We do have now two treatments that are kind of directed specifically at the virus that causes COVID, SARS-CoV-2. And these are called monoclonal antibodies. They're essentially like a manufactured antibody that helps to attack the virus itself. And so Alaska is working on distributing those products across the state to make sure that we've got that treatment option for those who it meet criteria and who could potentially help. So, with that, make sure that you keep your distance, mask up, washing your hands. I know it sounds repetitive, but those things make a huge, huge difference. We continue to see cases surge in the state. We see hospital capacity being strained. And really, you all as Alaska heroes make the huge difference in making this happen. And then just a special thanks to shout out to all of the law enforcement, the healthcare workers, EMS, the public health teams who worked throughout the Thanksgiving day and the weekend to be able to support our system as well as Alaskans across the state. It's greatly appreciated. So have a great day, have a great weekend, and provide more information soon. Thanks.